there's this it's a three-dimensional world that you're going to be entering into, and there's going to be this PT front, so to speak. It's a clinic that you're going to be able to quote unquote walk into. On the side of building community around your clinic, do you believe that this introduction into the metaverse and introduction into a PT clinic is a new way to build community for your clinic? And I suppose how would clinicians think about doing that? Like, are you going to be able to make it like look like a PT clinic? Do you want to do that? I mean, are we even able to do that? I guess like what does that look like in building community?
Sure. So that's a good question. We have at least two major modes that you can operate from as a PT. One is one-on-one. So it's you and the PT working in a room, an environment. So you can actually, the patient can select the environment. It can be sort of a clinic that's sort of in the outer space world, so it's a very sterile kind of environment, or it could be something, warm like the beach, or beautiful like the snow. So they get to choose that environment, whatever works for them. So obviously the PT can work with the person too, especially if someone's sensitive of the environment, like they don't like it, they can switch and toggle through that. And then we have sort of a group area for our lab. So you can have more than one person. So in terms of building community, you could do like group sessions in that lab space and have more than one patient in there. Obviously, again, you just like when like you're in skilled nursing, for instance, and you do like a group session, you'd want to make sure that patients are okay. Like, are you okay? Like working like with other people and getting their consent and everything. But that's one way I can see us building community, is having, one PT that's, maybe in the same practice, treating one patient on this side of the clinic, and then one PT on the other side of the clinic treating a patient. And be kind of cool. I think overall that would be a way that there's some interaction and patients can talk to each other and say, hey, what do you think? How's your sessions going? Oh, it's good. So it's not totally isolative, because I know that's one other concern. Some people are like, you're just basically taking out like that community feeling of a gym and all. It's like, well, not necessarily. We have that ability to do what we call like multiplayer, if you will, like having multiple patients in one room at once, if patients want to do that and if PTs want to do that. If they don't, they have that one-on-one model as well. So for that privacy and role focused care too. So I hope that answers your question in terms of community.
It does. It does. Yeah. And I was just going to ask, like, when is this going to happen? I mean, like, what are you, I know this isn't happening now, but these are all kind of like, foresight related questions where we're thinking about like, what does the future look like? I guess, do you have maybe a time frame or a rough estimate of like when we can actually be seeing this be implemented in clinics across the nation?
We do. Yeah, we have a roadmap, and our plan is to be in PT's hands by 2023. And it's probably going to be summer 2023, because we have our, knock on wood, phase 2 grant should be approved this summer, which will give us more funding to do more research studies to prove validity, reliability, and expand. So like I mentioned, lower extremity and balance. So that would mean we're looking at probably product release like June, July 2023. And then after that, we're just going to continue with improvements. So adding on maybe some of the components you talked about, like with concussion, and enhancing some of our neuro pieces, start building in population data and population type data points to help stratify clients in terms of risk and things. So 2023 for sure, summer, and then just building and getting better by 2024 for sure.